All right. Well, welcome to another episode of the Prescription for Better Living podcast. My name is Dr. Hernando Carter, board certified internal medicine physician, your primary care extraordinaire, and welcome again to Prescription for Better Living podcast, where our goal is to discuss all things health and wellness in a hip and relatable way. We have a very special guest with us today. Before I get into introducing our special guest, our intro song today, as you may have guessed, was a song that was written, produced, performed by my son, Ellis Carter. You can find him on iTunes, Spotify, all your streaming services as E. Casanova, and that was his song Fallin', Fallin. On previous episodes, I've told you about it, but I figured we would let you hear some of it. So if you want to hear the song in its totality, and I don't care if you want to stream it something like 10 times a day, we would like that, and just show him some love. But today we have a special guest with us. And as I introduce the topic, you will understand why our guest is here. So, our topic on today is all about therapy. And we're going to take a dive into it and have a conversation with our guest, who is Crystal Mullen Johnson. Crystal is the founder and CEO of Strive Counseling Services, located in downtown Birmingham. She brings a wealth of experience as an award-winning therapist with over 16 years of experience in mental health counseling. She earned her Bachelor of Arts degree and Master's degree in social work at Alabama A&M University. Go Bulldogs.
Go Bulldogs.
And she holds distinguished titles as a licensed clinical social worker, private independent practitioner, and registered play therapist. She is the president and founder of Nurture of Alabama, a nonprofit that provides mental health services to historically marginalized communities. So she is a practitioner and she's a philanthropist. Furthermore, Crystal's contributions extend to publications and media, where she's been featured in reputable outlets such as the Birmingham Times, Birmingham Business Journal, Voyage ATL, and the National Association of Social Workers. Her insights have reached a broad audience through appearances on WBRC Fox 6 News, CBS 42, WVTM, and various radio shows, including the Ricky Smiley Morning Show. That is impressive because I haven't been able to crack that glass ceiling. 95.7 Jams, 101.1 FM, and 107.7 FM. She is also an author. She authored 21 Day Journey to strive for a healthier you, a notable accomplishment that stands as evidence of her dedication to comprehensive well being and individual growth. So, as you can see, Crystal is a practitioner, she's an author, she's a philanthropist, she's a speaker, and she is here with us today. Welcome, welcome, welcome.
Thank you. I appreciate the introduction, and I'm so excited about having a conversation with you. You're such a great practitioner, have done so well, treating many clients' needs that we have shared in common. So I'm looking forward to us educating the community about mental health.
Yeah, Crystal and I have had a collegial relationship for a long time. Um, I started referring patients to her a long time ago, and they always came back happy and pleased with the interaction. So, Strive is doing great work in Birmingham community, and now is able to extend that work actually to more community-based programming through Nurture. And so it's been very cool seeing that growth and that evolution of what you're doing. But to start out, tell us about Strive Counseling Services. Why'd you start it? What are y'all about? What do you do?
Wow, wow. Well, I think we should just get started with why I started Strive. And
Hmm.
I am actually from a historically marginalized community. I was born and raised in Demopolis, Alabama. I lost my mother at extremely, I would say, a young age. And growing up in that community, mental health was not, encouraged. Mental health counseling was not encouraged. And my father was an entrepreneur, and I knew, my journey to her alma mater, Alabama A&M, would be pursuing social work and getting my master's, focusing on mental health, because I recognize the need in our community to educate, number one, about mental health, and then also to treat illnesses, because it's important to help our community thrive as medical providers or those that are working in the medical field. So
Hmm.
that ultimately motivated me as I was on my healing journey dealing with grief, recognizing how imperative it was for me to support those in the community, which I'm doing now in Birmingham. So Strive Counseling was established in 2017. Actually, I am approaching 7 years of business on July 3rd. We provide services to individuals, couples, and we work with, of course, young children and adults, I should say.
Hmm.
We are rooted in evidence-based practices, and as we talk more about therapy, you and I can dive deeper into
Hmm.
that. But we are unique in a way where we focus on establishing a foundation and foundational principles in terms of being like holistically healthy is focusing number one on what self-awareness and self-care management. So that's where I began with my clients in therapy.
Hmm.
And we have staff here that specialize in unique areas to treat conditions, which we'll talk about as
Hmm.
we continue on in the conversation. But we're focusing on helping our clients build a foundation to become healthier. So building a foundation for a healthier you.
That's phenomenal. We are here with Crystal Mullen Johnson, who is the founder and CEO of Strive Counseling Services. Hey, go ahead and subscribe, comment on this video. We'll reply to you. You can DM us, you can email us. You see it across the ticker there. But it is remarkable, Crystal. I didn't realize that you're just approaching 7 years
Yes.
because I know how many patients your practice has touched, and I know that the reputation that it has in the community, and for it to be under 10 years and to be where you are now, I think that is a testament to the services that you're providing and the space that you're filling, and then in the way that you're delivering that care. So,
Thank you.
because one thing I know about folk, and especially our folk, black folk, you know, if it's bad, it's gonna spread fast,
It
so
does. Yeah.
so that means that you're doing well. Very
Thank
good. So why don't we kind of just jump into talking about therapy, and because everyone may not be on the same page or the same level of understanding about, what therapy is, or just even the concept of therapy. So why don't you just broadly just explain to us what therapy is for people who don't know?
Sure, and you're right. And I think a lot of people base their perception on images, that they see, like whether it's on TV, someone sitting on the
Hmm.
sofa. Actually, I just got a sofa as of recently. Recently, I always had a chair. But
Okay.
having said that, I want your guests to recognize that therapy is a safe space. Consider it like a vault, a space that you can enter and know and be assured that your information is confidential. We are required to, when I say we professionals, we have code of ethics that we have to abide by and honor, and we have to adhere to that. The things that you share with us during the session is between, the client and the therapist. Okay, so that's most important. The second point I want to make is therapy is an outlet for self expression. It's an opportunity for you to talk through constructively. And I said talk to because you can talk to your mom, your dad, sister, friend, whomever. But when you're
Hmm.
talking to a professional, number one, the professional will be objective, meaning she should or he should not be aware, may not be aware of whom you're talking about, but they are providing constructive feedback. Your sessions are structured in nature, whereas data is collected to identify the problem areas that you are experiencing. And there is an opportunity for you and your therapist to discuss a treatment plan. In that treatment plan, you are identifying goals, meaning what's important, what's at the hierarchy of, you addressing in therapy. It could be several concerns, but you and your therapist are identifying what are the problems area and what are the steps, meaning the objectives that are required to help you achieve those goals. So there are different types of psychotherapy, as we refer to them as professionals, um,
Hmm.
and they are rooted in evidence based practices. And the goal of your sessions is to help you improve your thoughts,
Hmm.
okay, your mood,
Hmm.
and your behavioral responses. Dr. Carter treats conditions with medication, so pharmacological therapy. But
Hmm.
therapists, we do not treat conditions with medications because I have clients that say, "Can you write me a prescription?" No, I cannot, but I can
Hmm.
refer you out to a psychiatrist or a general practitioner or specialist that can, such
Hmm.
as Dr. Carter. But having said that, therapists, we, prescribe psychotherapy, and those treatment modalities are in place to help you improve the quality of your life, improve your decision making, improve your mood, and to help reduce the symptoms of mental illnesses, such as symptoms of depression. It helps reduce that, help you better manage stress, help you better manage your anxiety. So that's ultimately the goal of therapy.
That was a very great breakdown of therapy. And you highlighted something there in that I think a lot of the time there's apprehension about therapy because sometimes people don't understand the difference between, going to maybe a psychiatrist and maybe going to a therapist. And don't get me wrong, there's nothing wrong with psychiatrists or going to a psychiatrist, but except for that, I think that just the concept or thought of going to a psychiatrist is intimidating for a lot of people because particularly like you mentioned, like preconditioning, like movies and television, and you see maybe some uh, people being admitted to the hospital or being confined, and it's the psychiatrist who's behind it all, and we know that those are kind of misconceptions as well, but they think if I go in and I talk to this person and I tell them what's really on my mind, they gonna lock me up in
Mhm.
the hospital. But that is not the case. you brought up a good point about objectivity,
Hmm.
objectivity,
Yeah,
because I don't mind sharing this. I'm an open book, especially when it comes to sharing something that's going to help people.
that's right.
But I have gone to situations, let's say, uh, uh, spiritual counseling, where maybe I revealed something that I was doing or had done that may not be considered, very virtuous.
Hmm. Hmm.
And it was hard because I'm going to someone who's at my church, who I'm going to see every Sunday, and I'm going to see at special events, and I am supposed to be living this certain way, and are they going to judge me? Are they going to think differently about me? I mean, that's hard to be just totally transparent.
Absolutely.
So, in a situation with someone who's more clinical, and you kind of take that, that kind of, as for me, it was the aspect of, is my virtue going to be judged? um I was able to be more open and transparent with my therapist than I was with, let's say, a minister for counseling. And don't get me wrong, I'm all for spiritual counseling, especially when you're dealing with things that are spiritual in nature. But
Hmm.
I think there is room for both. But I
Hmm.
certainly think um, that there is certainly a place and a priority for the type of therapy that we're talking about today.
Absolutely.
So let's say I'm signing up as a client of yours. What can I expect, like, with my first, therapy session? What is my first new patient experience gonna be like with you?
Well, number one, your first experience is going to be excellent because you would talk to Patricia, our office manager. And really, the goal is like for us to reduce barriers for those that are seeking help because we recognize those barriers are number one, insurance issues that
Mhm,
knowing if you're covered for insurance. Number
mhm,
two, that fear, like you said, of like, am I going to be discovered or they're going to know me? How is this going to impact me? Whether you're
mhm,
a professional, whoever you are. And then number three, we want to make sure that you have the greatest fit or a good fit for you. Let me say that content based upon your problem areas. So when you talk with Patricia, Patricia will collect information from you, and we verify your insurance benefits. That is a very important service. Why? Number one, we don't want our patients to have surprise billing. Number two, we want to make sure that we are reducing your stress. It's already stressful trying to find a therapist or get someone on
mhm,
the phone. And
mhm,
we're answering the phone here at Stripe. But we want to make sure we collect that information, verify your benefits, and call you back within 24 hours and confirm what those benefits are. Also, encouraging you to follow up as well. And
mhm,
then next, we are exploring the best time or date for you to attend therapy. It is a really easy process. Scheduling therapy should never be stressful for you.
mhm,
So that's what sets Strive apart. Okay. So after that, we provide you information to complete in our client portal, which is really easy to navigate. And if you can't navigate that, we'll support you here on site in doing so. So your first session with your therapist will be considered your initial assessment. And during that assessment, we are doing what we consider a biopsychosocial. And in that assessment, we're exploring information about your background, your family dynamics, substance abuse history, if that exists, just information to help us better understand what you are experiencing. But what's so important in that process is your readiness, making sure, it's a good fit because that therapist may not be a good fit for you. You just may not mesh well, and that's
mhm,
okay. It's perfectly fine.
mhm,
And then the other thing is, we're just talking through next steps. And you'll follow up your next visit, which may be 1 week or it may be bi-weekly, depending on you and that therapist, agreeing on the best fit for you in terms of how frequent you attend therapy.
Mm-hmm.
And you are assigned some homework and required to work outside of therapy. Some people believe change happens like within 60 minutes of a session. It does not.
Mm-hmm.
You are required, there's a personal responsibility, a moral responsibility to take the skills that you are equipped with in therapy and to apply them daily. So it can become a behavioral response. You're replacing old behaviors with new behaviors. And it's also a responsibility of the patient to, ask questions or guide the therapist in a direction that they may not have considered going so you can get your needs met. So it's about you. Like you are the change agent. So it's up to you to get the best out of therapy by answering questions, being transparent, not pretending you're okay in therapy.
Mm-hmm.
So, so you don't have to wear a mask with your therapist. It's about being transparent and being willing to receive the help that's available for you. So that's the process here at Strive Counseling.
Thank you, Crystal. And we are with Crystal Mullen Johnson. She is the CEO and founder of Strive Counseling Services in Birmingham, Alabama, downtown Birmingham. So definitely, if you're in the Birmingham area, Birmingham metro area, surrounding counties, and you are looking for a therapist, a practice to go to, I highly recommend Strive Counseling. As I said at the beginning of this podcast, I have referred numerous patients to Crystal and have the utmost confidence in her and her practice. So check them out with Strive Counseling Services. This is the Prescription for Better Living podcast. Like, share, comment, and stay engaged with us. So you brought up something when you talked about insurance benefits, and so that made me think about a kind of a segue question, and that is cost. Because one of the other things is that people are intimidated with therapy because the perception out there is that therapy is for rich folks, right? It's
Right.
for
Yeah.
people who make six figures and have a lot of disposable income, and you and I know that that is not the case. That is particularly if you work and you have insurance benefits. Most insurance benefits do also come with a mental health benefit, and they
That's
will cover therapy sessions. And there may be a copay, but
right.
the
Hmm.
copay is going to be, the copay per session is going to be less than even if you were paying cash.
That's right.
But even if you were paying cash, the cash price is not cost prohibitive either. Am I right on both of those?
Yes, the your insurance benefits, of course, covers behavioral health. That's what we call it, as you
Mhm,
mentioned, mental health, which is used interchangeably. And there is a co-payment, but I think what's most important is that your guests need to understand when they're selecting their insurance plan that they explore what those options are.
mhm,
Because so often you're paying high deductibles, you're paying for insurance and you're not
mhm,
sure what your insurance covers. So
mhm,
those are the questions that you want to ask human resources. Okay.
mhm,
All kids is excellent, so affordable, really low co-payment. Blue Cross Blue Shield providers are covered in that network.
mhm,
As it relates to your employer, some offer what we call an EAP, Employee Assistance Program. And with those programs, you are provided up to probably 3 to 5 free sessions. And
mhm,
then there's a small copayment. So those are things that you want to consider. And beyond that, as Dr. Carter mentioned, I have a mental health nonprofit, Nurture of Alabama. We offer free counseling services. So that was one of the reasons why I started Nurture, because I
mhm,
recognized that counseling wasn't affordable for everyone. But now there's a nonprofit, you're going to get the same quality services at Nurture of Alabama or some of these other amazing organizations, Impact Family Counseling,
mhm,
Gateway, Oasis. So those services are affordable on a sliding
mhm,
scale, depending on the organization, but they're nonprofits. Or you may not have to pay for anything, but you have to ask questions and get the
mhm.
process started.
Yeah. Great. Thank you for that. And then, so who should consider therapy? I mean, are there people who, you know, should consider it more than others, or is it just kind of equally recommended, or who
I
should
would
consider going to a therapist?
Yeah, great question. So I would recommend therapy for everyone. Like, why not? I mean,
Mhm.
why not have a safe space where you can talk to a professional and guide you in your decision making? Why not have a space where you know that you are speaking to someone in confidence, where your business will not be spread, in the community? So I think it's important for us, like, to consider that, just like your wellness check with your medical doctor, consider having a mental health provider on hand, that you can contact, whether it's once a month, bi-monthly, once
Mhm.
a year. It's just important to have those check-ins. Like, you go to your wellness check once a year, talk to a mental health provider once a year.
Right.
But for those that have mental illness diagnoses, depression, anxiety, um, mood disorders. Like, you want to consider having a therapist that you can work with on a consistent basis to
Mhm.
help you manage those symptoms. Treatment is important for men. It's Men's Mental Health Month, so men, advise or encourage you, always attend to your mental health. And I know there's a stigma, of course, associated with mental health, but
Mhm.
we have to do a better job having conversations about our mental health and being open to receiving help. Children are also greatly benefit from therapy.
Mhm.
I provide therapy to young kids. There's treatment modalities for them,
Mhm.
play therapy, which, play is a natural medium for kids.
Mhm.
Unlike adults, they can't, they communicate their emotions through play, and adults linguistically, can kind of talk through their challenges. And women, couples, if you're having marital conflict, great place for you. Therapy is a good start to identify the problem and identify if you can work through those challenges. So therapy is beneficial for those that have stress, anxiety, depression, marriage conflict. You need some guidance in, your decision making, anger
Mhm.
management. I mean, it's just very, like, healing and beneficial if you navigate that process honestly and have a good match to work with you to deal
Mhm.
with those challenges.
Yep, I totally agree. I often say that I think that every person should have a therapist.
Hmm.
Whether you feel you're having some challenges in the mental health space or not, it's still a great stress reliever. It's so therapeutic just to be able to talk about what's on your mind, maybe what's been bothering you, what concerns you have, and just really help. And it gives you sometimes new revelation because you get different insight. Me personally, I again, I don't mind sharing that I have dealt with depression and anxiety for years, and therapy is kind of where I began to heal and develop coping mechanisms and kind of understand some of my, where some of this originated for me and what some of my kind of less constructive thought patterns are,
Hmm.
as it relates to kind of overgeneralizing. If one bad thing happens,
Yeah,
oh, it's all bad.
I know.
That they call catastrophizing.
Yeah,
I've learned that I do that sometimes. So
yeah.
for me, it has been very, very helpful, and I know a difference within me if I'm going regularly to a therapist, or if I take a hiatus that's too long. I
Hmm.
can start, feeling some of those old thought patterns, those old feelings kind of creeping back in.
Hmm.
So again, like you said, and this was not rehearsed. I did a video a while back, just like a social media clip, and I said, you know, therapy is Therapeutic is
Mhm,
beneficial. That's why it's called therapy. I said therapists are objective. I
mhm,
said therapy is confidential,
mhm.
and therapists are bound by privacy laws, and so you don't have to worry about your business being all out in the street, as you would if you were kind of getting a homeboy or a girlfriend therapy session. They probably gonna run and tell somebody,
Right.
So, but therapists, that won't happen. So, absolutely. And what I can say is, you brought up another good point about transparency,
Mhm.
because if you're not totally transparent with your therapist, then you won't get the benefit that you need to get.
That's right.
And so the other thing about going to a therapist for actual therapy is that pretty much therapists have heard it all. There's not too much that you're going to be able to kind of shock the therapist by what you're saying. And so with that, you can feel comfortable and open with just I like to call it kind of verbal diarrhea. You know what I
Yeah,
mean? Just take the filter off
that's right.
and just say what you feel and what you think.
That's
You
right.
know, and so I think that, and you tell me if I'm wrong.
Mhm.
Therapy is something that is totally underutilized in our community, in the Black community.
It's totally underutilized, and I mean,
What can
even
we do? What can we do to change that trend?
yeah, I think there needs to be a shift of our mindset about therapy. As you mentioned, like you and I are providing some psychoeducation, like we're educating people about the benefits of therapy. We talked a bit about some mental health conditions. Of course, we can acknowledge that there's a stigma, but also, shift the conversation. What can we do to support you? Being more open to hearing, people's struggles opposed to supporting them and wearing a mask. Okay. That doesn't
Mhm,
benefit anyone, and sweeping, if you will, things under the rug. I mean, we have to be self aware. I think that is critical. That's the only way you can begin your healing journey.
mhm.
And it's so necessary. I mean, we can help our communities thrive, our families thrive, our children. It's just vital that we are having open conversations about it, whether it's in the barbershop, hair salons, not gossiping, but how can I help you? Or,
Mhm,
hearing about people's troubles and directing them to people like myself
mhm,
or some of these amazing therapists in the city of Birmingham or
mhm,
wherever you are, wherever you're listening.
mhm.
To us from identifying resources that are available
Yeah,
because it's about healing our community and it is so necessary.
absolutely. So in conclusion, and my wrap up is this: I think, especially our people, a few things you need. You need a good barber or a beautician,
Mhm.
stylist, right?
Yeah, always.
You need
Yeah,
a primary care doctor.
that's right.
You need a dentist,
Hmm.
and you need a therapist. I hope that we have hopefully just removed some of the stigma surrounding therapy, to let people know that, first of all, there's nothing wrong with having a therapist. It's actually pretty normal, just
Hmm.
like having a primary care doctor or a dentist, and that therapy is accessible and affordable to everyone. And it is something that everyone should look into doing. Even if you don't feel you have any challenges right now, just try it out one time, and I'm pretty sure that you will be convinced that therapy is beneficial for everyone. So I want to say thank you to Crystal for coming on. Please check out Strive Counseling Services, but also check out Nurture,
Hmm.
because they're doing some great work in the community. Got a community event coming up in about a month, and it's going to be all about mental health and promoting that in the local community here in Birmingham. And we certainly support that. So, hey, y'all, this is Prescription for Better Living podcast. where we discuss all things health and wellness in a hip and relatable way. Hey, tell everybody, scream it from the mountaintop, preach it everywhere you go. Hallelujah, Dr. Carter is here. Until next time, Dr. Carter, Crystal, out.
Peace. Thank you.